Have you ever felt overwhelmed, anxious, or just down? Trust me, you're not alone. Mental health struggles aren't just personal battles. They're a global crisis affecting millions. Today, I want to open our eyes to the facts, the numbers we can't afford to ignore. Here's the big picture. According to the World Health Organization, 1 in 8 people on the planet lives with a mental disorder. That's more than 1 billion people. Imagine every 8th person you know, family, friends, co-workers, living with anxiety, depression, or something else. And things got worse after COVID-19. The pandemic triggered a 25% spike in anxiety and depression worldwide. We're still feeling that wave. Mental health isn't just about emotions. These conditions are now a leading cause of disability everywhere. They shape how we live, work, and connect. But let's dig deeper. Because the crisis is especially tough in low and middle-income countries, or LMICs. In these places, poverty, war, disasters, and daily adversities hit hard. Imagine living with constant uncertainty. Anyone's mind would feel the strain. Here's what shocked me most. In many LMICs, over 75% of people with mental, neurological, or substance use disorders get no treatment. Nothing. Not a single session, not a single pill. Millions suffer in complete silence. Why? There just aren't enough resources. In some countries, mental health gets less than 1% of the health budget. There might be only 1 mental health worker for every 100,000 people. No hospitals, no clinics, sometimes not even a single therapist in sight. Then there's stigma. Deep, powerful, and isolating. People hide their struggles out of fear, shame, or just plain misunderstanding. Even if there was help, stigma keeps them in the shadows. And because mental health care isn't integrated into regular clinics, most people never even get asked how they're doing mentally. Some numbers are truly heartbreaking. Depression is now a leading cause of disability worldwide, especially in developing countries. And here's a chilling fact. About 77% of all suicides happen in LMICs. People with severe mental illness can die 10 to 20 years earlier than their peers, mostly from preventable health issues. This isn't just a health problem, it's a human rights crisis. So what can we do? First, we need more funding. Governments and global organizations have to invest in mental health like it really matters, because it does. Next, mental health needs to be part of everyday healthcare. If you can get your blood pressure checked at a clinic, you should be able to talk about your anxiety or depression there too. We need to bring care into communities, train local workers, support families, and make help accessible where people actually live. And we have to crush the stigma with conversations, education, and respect. Here's the thing, you have a role too. Share what you know. Support someone who's struggling. Speak up for better services, locally and globally. Because behind every statistic is a real person, a real family, and a real future. The numbers are urgent, yes, but together we can turn them into action. Mental health matters for everyone, everywhere.